stage 3B cardiac amyloidosis, as we all know, it's a very difficult to treat population, given these patients are usually extremely sick and frail at diagnosis, with advanced cardiac involvement and with an NT-proBNP of more than 8,500 by definition. So the Andromeda trial, which initially tested daratumumab plus CyB versus CyB in a randomized fashion, did not include stage 3B patients. It included patients with stage 1 to 3A. Hence, we at Columbia University and also at Cornell University, the New York Presbyterian Hospital, we looked at a retrospective case series on all patients with stage 3B AL amyloidosis who were treated with daratumumab plus CyB in a dose-modified manner since the institution of this regimen at our hospital, which was roughly around mid-2019. And we had a total of 21 patients who were treated with dara-CyB. We had to exclude 3 patients for some or the other reason because they were not evaluable, and 18 patients were included for our analysis. So we found that among the 18 patients with stage 3B cardiac AL amyloidosis who were treated with dara-CyB, we found that the 12-month overall survival in these patients was 65%, which is significantly better compared to the historical control data that we have from various large retrospective cohort studies in which the 12-month overall survival ranged from approximately 25 to 30%. So it's almost double that we saw in our cohort. Of course, these are small numbers. We definitely need to look at larger number of patients and at a longer follow-up, but definitely seems promising, and it seems like the dara-CyB may be able to make a dent in the natural history of this disease and decrease early mortality. 7 out of 18 patients, so roughly 40% of our patients in this cohort, unfortunately died within the first year. So the early mortality rate is still significant, and we need to improve on that, mainly by early diagnosis. And we will see if antifibril antibody treatments, there are 2 currently clinical trials ongoing. One is the KALE-101, and the other is the drug by Prothena, the NEO-D001 or bertamimab. And it would be interesting to see whether those antifibril antibodies can make a further dent in the natural history of stage 3B patients and decrease early mortality. So overall, we found really promising efficacy signal. The response rates, the hematologic response rate was comparable to the Andromeda trial, the CR rate of approximately 50%, and the organ response rate in our cohort, the cardiac organ response rate was also approximately 59%, so almost 60%, with a high number of patients achieving a deep cardiac response, that is a cardiac VGPR, very good partial response or better. We did not have any treatment-related mortality. However, we did see grade 3 or higher infection in approximately 20% of patients, including 2 patients who had CMV viremia. Hence, it also highlights the importance of monitoring for infections, including atypical infections such as CMV in this patient population. So we are excited about the data. Now we need more prospective studies on single-agent daratumumab, which is one of them is already ongoing by the European Myeloma Network, and maybe even combination therapies in stage 3B AL amyloidosis, and the addition of antifibril antibodies to potentially further improve outcomes.